What might end up being worse, the swine flu or the fix? Growing fears of a new pandemic giving way to new calls for national health care in this country. Hello, everyone. I'm Cherry Keenan, and welcome to Cashin' In. Our Cashin' In crew this week is led, as always, by Wayne Rogers, Jonathan Honig, Jonas Max Ferris, along with Tracy Burns and John Bradshaw Layfield. Also joining us today, Democratic strategist Julian Epstein. Welcome, everybody. Okay, Jonathan, it's impossible to know the course of this flu, and it is scary. But will it put us on a faster course towards national health care as well?
Well, it is, Terry. It seems to be, and it's terrible. I mean, government should take steps, as it is, to control these, contagious outbreaks like the swine flu. But that's different than the belief that you have a right to be cured, of any illness you get, no matter how much it costs, no matter how irresponsible you've been with your own health, all paid for by, society. I'm not an MD, but like swine flu, that is a national health emergency. This one's insulin, this one's kidney is not. And it's just a shame that it's being used to further that agenda. But
Wayne, I mean, if there's any role for the government in health care, it certainly would be in this case, the threat of a pandemic.
Yes, I agree, but I think we as citizens have to take some responsibility for this, keep our hands clean, do all of those things, when you cough, cough into something, do all of those things, be responsible, and to use this, like Jonathan says, as an excuse to further a political agenda is somewhat outrageous and disingenuous.
JBL, do you think, though, that is going to happen? Because there have been people making the connection this week.
Oh, there's no doubt about it. Look at this. Look at what you compare this to the avian flu. There was a 70% mortality rate with the avian flu. With this, it's about 5%. About 500,000 people die every year worldwide with the regular flu. Right now, you're talking about 12 people. This is horribly overblown. I hope it doesn't spread. But right now, they're making a lot to do about not very much.
Julian, do you agree?
No, I think this is a straw man, and I think unless you've been living in a cave, you would realize that the debate about, or the issue on swine flu and the debate about national health insurance have nothing to do with each other. The issue on swine flu is about a public health effort to contain the spread of the disease. Almost all epidemiologists are in agreement as to how to do that. The issue on national health insurance, which has nothing to do with that, is how to fix a broken health insurance system that wastes 25 cents on the dollar, that is suffocating small businesses, and that leaves 1 out of 5 Americans out in the cold. These two things have nothing to do with one another, and people, the opponents of national health care reform, that try to argue that people are making an unfair connection between the two are really creating a straw man argument. They have nothing to do with one another.
But they are, though. I mean, they are creating the argument, Julian.
They're absolutely unrelated.
The administration is being opportunistic at this point and making it...
Who's making the argument?
The administration has come out and said that it is time for national health care, using this as a little prop to push the agenda a little bit further, and we're seeing it.
That?
So it's part of what's all over the media. And
I disagree. Who said that? Who said that?
Jonas,
name one official that said that in the
administration. Julian has a point, but the pro-healthcare agenda people, the lobbyists, are making a connection.
There's no, they're not. They're not. People. These are totally unrelated issues.
Well, actually, is it unrelated? I mean, trips to emergency rooms have gone up a lot in the last few weeks because of this media hysteria. Now, why are they going to emergency rooms? Because they don't have national health care, and that's what people do who don't have health care. They go to emergency rooms and burden the system with their costs. So I would say they are related. I don't know if the administration is putting the two together, but that's a direct relationship. Now, does that mean the government should pick up all the bills here? This is not a very dangerous thing yet, and frankly, there's more ways people die that are very casual that conceivably the government could pick up. I'm surprised Jonathan even thinks this is a national emergency that requires the government to pick it up, because frankly, it's very unlikely more people are going to die driving to the emergency room than they are from
What's happening is that the apologists for the health insurance industry are trying to say that the administration Democrats are exploiting the swine flu issue to promote national health insurance.
Oh, wait a minute.
That's a bogus argument.
But Julian,
there's nothing there's nothing to back that up.
That is completely false. Your vice president, Joe Biden, and my vice president, too, by the way, because I support these guys, just came out and said, don't take the subway. You've had 12 people die. I've got my subway card. I'm going to take the 7 train to watch the Mets, who unfortunately can't win a baseball game right now, and I'm stuck with season tickets. But this fear-mongering is what's causing this hysteria. You've had 12 people die, period. 36,000 died last year from the flu, the regular flu.
Okay, but Jonathan, we don't know how fast this is going to spread, and there is a potential of a pandemic, and I think anyone who ignores that is not being prudent here. But so far...
Hell yeah, Terry, absolutely. And that's why I'm, so glad that we actually have some semblance of a private healthcare system that manufactures the cures, the remedies, the amazing medicines that better man's life on Earth. I mean, can you imagine how terrible our healthcare would be if we got a nationalized healthcare plan after, like, the bubonic plague? I mean, we would be, like, sucking on wounds and pouring alcohol on wounds to clean it. It would be disastrous. But
and again, this is an example. This is an example. I think what Jonathan just said is an example of how the health insurance industry apologists try to confuse this issue. Nobody is talking about a national health care system. What Democrats in the administration are talking about is reforming a health insurance system. And those two things are very, very different.
Does the president
it's very easy for the apologists of the health insurance industry to confuse people and confuse these two issues.
Does the president believe that everyone has a right to health care, yes or no?
I think he does.
Yes, he does. And Wayne, so far...
That is a national health care program.
Do you believe... No, it's not. It's not a health care... No, John, there's a big difference between health care delivery and health care insurance, and apologists for the insurance industry like yourself like to confuse those people because they like to scare the public. When we talk about reforming health insurance, it doesn't mean socializing or nationalizing health insurance.
Wayne, I'm going to get...
very different issues.
Wayne, I'm going to give you the last word. So far, the system as we have it is working in terms of the swine flu.
Yes, and that's true. But I think Julian has a point. They really do have nothing to do with each other. I mean, national health care and the swine flu any more than cardiac arrests have to do with it, everything. If you want to make an argument about National Health Service and all that, right now we have nobody is turned down. If you go to a county hospital, you walk into an emergency room, you get free health care.
You do, so even if you're an illegal immigrant. Okay, we got to leave
correct.
it there.
No, wait. One other thing.
Right.
No, you've got to say it's the cost of this. That's what you've got to address. You've got to address the cost of it.
You're right. Okay, thanks, Wayne, as always. Thanks.